Hi, I'm Chantel and I'm a podiatrist here at East Coast Podiatry in Singapore. Today we are answering the common question of, can I fix my child's flat foot? Yes, a child's flat foot can be treated, but this depends on the nature of the foot, the age when intervention takes place, and other associated factors. On its own, flat foot is not a medical condition, but it is a risk factor for other conditions, such as plantar fasciitis, Achilles tendonitis, malalignment of the foot, ankle sprains, and many more. If you or other members of your family have flat foot, it is more likely that your child will be flat-footed as well. Flat foot, or medically termed pes planus, is the flattening of the arch of the foot. The degree of flatness can range from simply having an arch that is lowered in appearance to having the entire sole of the foot in contact with the ground. In some cases, one foot may be much flatter than the other. Babies are often born with flat feet due to their increased flexibility of the bones and joints, as the foot is mainly made of cartilage tissue. This can persist into later stages of their childhood and even into adulthood. When flat foot persists, it can lead to differences in gait and can worsen. Flat feet can also be a symptom of misaligned feet, which can eventually cause pain from the foot to the knees and even the hips and the spine. Now, broadly speaking, there are two types of flat foot: rigid and flexible. If your child's foot is flexible and they are able to create an arch with tiptoeing, then the arch can be guided during pediatric growth. This is until skeletal maturity, where cartilage ossifies and becomes bone. If the foot is rigid or fixed in a flat foot position, you should seek clinical assessment as soon as possible. Rigid joints in a pediatric patient require accurate and in-depth specialist knowledge and investigation to evaluate the success of conservative treatment and long-term outcomes of the condition. If your child is experiencing pain, fatigue, clumsiness, or delays in their development, seek advice from a podiatrist, as there may be underlying causes for your child's difficulties. Early intervention is recommended, as the best time to address these issues non-surgically is before the child reaches skeletal maturity. Once a child has finished growing, significant changes can be more difficult to achieve. So in conclusion, if you are worried about your child's flat feet, it is best to bring him or her to a podiatrist so we can come up with a suitable treatment plan to address the issue.
For more information on related conditions, check out our other videos.